I'm a teacher and a mother and a coach. But I've always struggled with my weight as far as my body image. So basically, I would look at the scale every day. And back in October of last year, I decided 130 was too big, and I am 5'9". By January of this year, I had gone from 130 to 118. And I had become severely depressed. I didn't want to leave my bed, and I just wanted to waste away. So I needed, at that point, to be under 100. And so I worked to get to under 100.
I think one of the big misconceptions about eating disorders is that they're a choice or that they're trivial illnesses. And anorexia, for example, is the most lethal psychiatric condition. It's caused by a combination of genetic environmental factors, and over time, they tend to take on a life of their own, much like addiction. My goal is really to set a standard for the care of eating disorders, especially intensive treatment, and to demonstrate that the kind of treatment that we are offering here at Hopkins really does improve outcomes. For the major eating disorders, anorexia nervosa and bulimia nervosa, binge eating disorder, and avoidant restrictive food intake disorder. So our first step in treatment is to help patients weight restore through the inpatient program so that starvation doesn't perpetuate the thoughts and feelings associated with the disorder. And the second goal is to help them eat a wide range of foods and to overcome anxiety that they've developed. So our partial hospital is focused on helping patients to eat in a number of different social settings. And a unique feature of being here at Hopkins is the access to medical specialists in really every field. And in that sense, we are able to treat some of the sickest or most complicated cases.
So Dr. Guarda was just another doctor in a long line of doctors my daughter Stephanie had seen over 16 months. But Dr. Guarda, she was the first doctor to inform us that she actually knew how to help Stephanie.
Stephanie was atypical because she really didn't have marked fear of fatness. Her disorder started because of another medical condition. So I felt confident, having seen other patients like this, that there was a very good chance that if we admitted Stephanie and if we normalized her meals and her intake and regularized her bowel, we would be able to help with her mood and her general level of function, which indeed is what happened. The transformation in Stephanie is amazing, really.
So my husband and I decided to endow the professorship to basically thank Dr. Guarda, and then for her to have the resources to actually do her research, which then informs the care of her patients, and then, to teach the next generation of professors.
The Stephen and Jean Robinson Professorship has allowed us to provide a yearly conference to train providers on how to recognize and treat eating disorders. And it has been instrumental in allowing us to fund pilot research in both the mechanisms that may help to sustain the disorders once they are established, and in understanding strategies to best teach patients to relearn how to eat through behavioral approaches to treatment. For instance, Angel, she's actually done very well in treatment.
They have nailed the program through research and through implementation. When I go home, I actually have a program to follow, and I do have hope now. I have hope for my future, and I just can't wait to get back to see my children.